Good evening, good evening, everyone. Welcome to another Jael Joseph Live show. Thank you so very much for joining us. Wherever you're locked in, I want to say special good evening to the folks locked in on Facebook. If you're locked in on YouTube, those of you on LinkedIn, good evening to you. And those of you on X, welcome to the show. We're doing it a little bit different today. I know I'm not accustomed of coming on a Tuesday night, but with social media, we can come on when we want, right? Once there's information, we're gonna come on whenever we need to. And this week happens to be vaccination week, and I have lots of questions, and I'm sure you do too. There are things that you probably want to know, questions that you probably scared to ask, or you're uncertain about certain things where vaccination is concerned. I know a lot of folks have the misconception, or they may associate vaccination instantly to COVID vaccine because this is very fresh in our minds. It's something that we've had to live through, and you might say from the time you have vaccination, bonje mopada za fesala, mopada sa, or so long COVID finish. What are they talking about vaccination? But vaccination is a really broad topic. It's a really broad conversation, and I am happy to have the folks from the Ministry of Health, Wellness and Social Services, particularly two lovely nurses, are going to be joining us. And Jael is a fan of nurses. My mom was a nurse. My aunt is a retired nurse. I have quite a few nurses in my family, and I decided not to become a nurse. I feel like the nursing profession, many are called, but few are chosen. And we have two very chosen ones who are going to be joining us here this evening. And they're going to be sharing some information with us about vaccination week. Why is it important? Why we need to be informed? What are some of the things that you may have questions about that you need answered? And just kind of get into the nitty-gritty of vaccination. I feel like we need to start having these kinds of conversations that reach out to things that we're involved in our communities, things that pertain to our health, our wellness. These are conversations that we have to continue to have, and I just want to thank all of you for coming on. And I want to remind you, share the live. Once you've dropped on, share the live. Let somebody else know. Tag a friend, tag a new mom, tag somebody who's probably expecting who has a baby, tag somebody who's probably had COVID-19, tag somebody who probably never got vaccinated, tag a friend and let them know so they can come in and get the information from the nurses. They are two of our trusted health professionals, and I'm so very happy to welcome them on here to the show today. So without further ado, I want to welcome Dr. Nurse Carbon, Dr. Yue, and of course Nurse Lewis, who's joining us. Good evening to you guys.
Hi, good evening, everybody. It's nice to be on
Welcome.
with you.
Nice to be here. I'm so happy to have you guys join me. First of all, just I'd like to let you guys introduce yourselves. So let folks know who you are, what district you're on, what type of nurse you are, because there are many different types of nurses. So let us get a little bit of information in terms of getting to know who you are. So I'll
All
start
right.
with Nurse Lewis.
Yes, I will start. I'm excited to be here with you tonight, and just to be on with you, Jael, is really an absolute pleasure. I am Florestin Lewis. I am the Senior Community Health Nurse for Region 1. Primary healthcare is divided into two regions. You have Region 1 comprising of the Roseau, Grand Bay, and St. Joseph Health Districts. And Region 2, St. Portsmouth, Lapilane, Marigot, and Cassibus Health District. So I'm responsible for Region 1, which is more than half of the population, because Roseau alone is almost 36,000 persons. I also have the responsibility for what we call the EPI program, which is the expanded program on immunization. So I am the EPI manager. I've been a nurse for almost 39 years.
Wow, you
Yeah,
you
so
you an adult in the nursing profession.
yes, and honestly,
Come on.
like you said, some people are called, and I think I was one of them that was called. Nursing chose me as a profession, and I just love what I do.
That's
Yes,
amazing. That's amazing. And thank you very much for explaining to us who you are, the district. And I didn't really know the districts and how they were broken up, but thanks for sharing that with us. I think that gives us a lot more clarity as in terms of your role and how much information you would have gathered because you oversee, like you rightfully say, over 36,000 people,
that's
right?
correct.
And we also are joined by Nurse Yvonne Carbon. Welcome.
Good evening, and thank you for having me on your show, Jael. I've been hearing a lot about you, and it's just a pleasure to be finally here on your show. So, I am a public health nurse by profession, and I am responsible for the Castlebruce Health District. So, this is the area from Petit Soufriere up to Crayfish River, half of Crayfish River in the Kalinago territory. I do not have as many years experience as Nurse Louis do. However, July of this year, I will be 23 years as a nurse.
Use Guafam. Use Guafam. You are it's good to meet you. You do also have a fairly huge district in terms of where you and a lot of the communities are far. I find
Yes,
where
they
you're
are.
so that puts so one has a huge district and one has huge gaps in their district. Uh, so I think you guys are meant to be on here, and I'm very excited to have you both join me here so we could talk a little bit about Vaccination Week. Of course, this show is sponsored by PAHO. That is the Pan American Health Organization, and they ensure that a lot of the work is done on the ground in terms of paying attention to communicable diseases, vaccinations, and so on and so forth. So we'll get into it right away. And I want to first of all kind of get an understanding of what is the importance of vaccines in terms of preventing infectious diseases. I remember uh, because I'm very nosy, I do a lot of research, and you'll hear, oh, when penicillin was introduced, and how they told them not to drink rum, or don't drink alcohol because it wouldn't work. So what exactly is the role or the importance of vaccines in terms of preventing infectious diseases? I don't know if Miss Luis, you want to go first, since
Yes, I could answer. So, vaccinations and vaccines are very, very important in preventing disease. So, when we give you a vaccine, there are various types. It could be one that is injected into the body, it could be one that is taken orally, that is through the mouth. They also have vaccines that they call intranasal vaccines. So, for example, the influenza vaccine is sprayed into the nostril. Okay, so there are various routes of administering those vaccines. So they are like antigens, okay? And an
Mhm,
antigen is something that is kind of foreign to our bodies, but when it is injected or we swallow it or it is spread into our nostrils, our immune system recognizes it as a foreign substance. And what does our body do? It creates antibodies. So they're like soldiers that
mhm,
come up and they take a shot at those antigens that was just injected into the body, and we develop our own immune response to those antigens. And when we do that, our body we become protected. So we say that we have developed immunity against whatever vaccine was introduced into our system.
hmm. So I'm glad you started on that note. Talking about vaccine. Like I said at the introduction, many people hear of vaccines today and they say, COVID vaccine. They automatically. I swear, COVID was dubbed COVID-19 vaccination is the only vaccine right now. That seems to be the misconception. But I know before COVID came about, vaccination was part of our day to day in terms of in terms of thinking about when you have a newborn baby, what sort of vaccines, you have your little child health passport, and you go in at different intervals to have to get vaccinated. As far as I've learned, that has kind of plummeted in the sense of a lot of folks are not actively going in to get their children vaccinated and all of these things. Why is it important to have a vaccination week this?
And
Let's
that's
start
all
with
you want to go at that one.
Okay, so every year, this is an annual celebration within the region of the Americas. So from the 22nd to the 28th of April every year, within the regions of the Americas, a theme is selected, and all the countries in the region, we work towards that theme. So this year, our theme is Engage Now to Protect Your Future. Engage now to protect your future, because we realize if you have to protect your future, which are our children, we need to get them vaccinated. And as Nurse Louise said earlier on, when you get these vaccines, your body recognizes as foreign. So it creates antibodies, which are your little soldiers. So in the event you should come across that disease, your body can already identify it and to help fight. So every year, we just seems to be raising awareness as it relates in terms of vaccination. All through the year, through our various health centers, in our clinics, we have vaccinations are being conducted for children. We go to the schools to administer vaccines. Various workplaces may require vaccines. We do that. But every year during the 22nd to the 28th of April, this is specifically set aside as Vaccination Week of Americas. So we are more or less on a hype during that time as it relates to vaccination.
thank you, Dr. Cavan. Doctor. I want to call you doctor. I don't know why.
Jael, you have
I'm
a
manifesting
dream,
now.
man.
I'm manifesting that on you, my lady. I'm
I
manifesting this
I
on you.
love nursing. I love nursing. A nurse to the core.
Yeah, I love that. I love that as well. Okay, so explain to me what type of vaccination, okay, from the time you were born, what type of vaccination, or what should be your vaccination, the vaccination protocol that should happen in every household. So from the time a baby is born, taking them from the time the mom has the baby, what sort of vaccines should a mom be looking into, or parents I should say, because sometimes it's both. What sort of vaccinations should they be paying attention to? Because a lot of people don't really know, and they just kind of go with the flow. So if the nurse, you have your baby, you probably have your baby at the hospital, the doctor will tell you, or the nurse will tell you, in a week you need to come and check the baby, in 2 weeks you need to do this and whatever. What are the stages of vaccination that someone must take when it comes to a newborn, Miss Louise?
Okay, so we have quite a number of vaccines. So if I leave out any, then this carbon will also assist me in that area. So the very first vaccine that is given to a child is the hepatitis B. We call it a birth dose. The thing is, hepatitis B is a vaccine. Well, it's a disease that causes cancer of the liver. There is no cure for hepatitis B. Hepatitis B is transmitted similarly to how you get HIV. So through blood, through infected needles, and so on, through sexual activity. It can also be spread through social contact. The thing about hepatitis B is that what the mother that is pregnant is can transmit that virus to her unborn child through the placenta. And so the baby may be born with hepatitis B and might remain a carrier for a very long time. And remember, I said there is no cure. And what happens is when the baby has hepatitis B, the baby is able to infect many others for about 2 years with hepatitis B.
Wow.
So we give hepatitis B at birth so that if the mother is hepatitis B positive, then the baby can be protected. Okay,
Okay.
so that is the first vaccine the baby gets in the delivery room, a
Okay.
hepatitis B birth dose, and we consider it a zero dose for hepatitis.
Is it like how is it administered? Is it
An
administered?
injection. It is an
Okay.
injection. It is
Okay.
just like we give other cares at birth. So, for example, we give vitamin K to
Mhm.
the baby, and that is an injection. So, as part of the birth process, the delivery protocols that happens after birth, hepatitis B is one of the vaccines that's administered.
Mhm.
Then at 2 months, or within a month to about 2 months, when our baby comes to us, we give the BCG vaccine. This BCG is against tuberculosis. And we know that tuberculosis is endemic to Dominica, meaning that it is always present in our country. So every now and then, our nurses, we have to do what we call DOT, which is direct observed therapy. That's when we have to supervise the person who has been diagnosed with TB and make sure that they get their medication and they take the medication as prescribed. One of the reasons for that is because the person who does not take the TB medication as prescribed can develop what we call resistance to the antibiotics. And so that if I have resistant TB, then I spread resistant TB to you. And then it will be more difficult
Mhm.
for you to get treatment because of your resistant type of TB. So we give the babies BCG between from birth to up to 2 months, but our cutoff point is a 1 year for that particular child. Then at 2 months,
So
we
let's say that baby did not get it
at two
before
months
at 2 months,
they
or
have
even before.
all they have up to 12 months to get the vaccine.
Okay, good, good. Continue.
Right.
Mhm.
Then at that same time, the baby is also given a vaccine that we call pentavalent. It contains 5 different vaccines: the diphtheria, tetanus, pertussis or whooping cough. We have the hepatitis B, as well as the Hib, which is one that protects the child against meningitis and pneumonia. So the diphtheria is a bacteria that causes diphtheria, and what happens is that it forms a membrane over the throat of the child, and when the membrane is there, it produces a poison or a toxin, and this is swallowed by the child, and it can affect the child's heart, and also the membrane can block the windpipe, and so the child suffocates because of lack of air, oxygen, and the child can die. The child will also die because of the toxins that the bacteria produces.
And
That is the diphtheria.
so that comes in one vaccine, right? That is
That's
one.
correct.
Okay.
One. That's
Okay.
one vaccine.
All right.
Okay? And so the pertussis is another name for pertussis is whooping cough. So
Mhm.
there is a characteristic whooping sound that follows the child coughing. And the child coughs constantly without being able to take a breath. And so the child will also suffocate because of lack of oxygen. So the pentavalent has those 5 different vaccines in there. We also give them the IPV, which is an inactivated polio vaccine. When we say inactivated, we mean that the virus causing polio was killed or weakened, so it cannot cause disease. And so
Okay.
that is also given as an injection.
So explain that to me. The inactive polio. What is the difference between? Because you say it's inactive. Are the other viruses active in the other vaccines? Is that what you're?
Okay, so there are two what we call live vaccines, meaning
Mhm.
they contain a weakened form of the virus.
Okay. So that is
Okay,
why
so
babies can get a fever when they.
right, that's
Right. Okay,
Right,
so
correct.
correct.
that
That's
explains. That
correct.
explains. So it's a
But
weakened form, and you just have to manage. If the baby
the
gets a
symptoms,
fever, you know to keep them next to a fan, keep their body cool, and so on and so forth, so they don't develop a high temperature.
right?
Okay.
So the child at 2 months will receive the pentavalent and the
Hmm.
IPV as well as the BCG vaccine.
Hmm.
Okay. Now
Hmm.
this is repeated at 4 months and also at 6 months.
Okay.
So at
Okay.
6 months, the child should have already received first, second, and third doses of pentavalent and polio vaccine, as well as
Okay.
their BCG. So I will let Nurse Anatole do the
All
rest.
right. Understand as well.
Although I know Jael said that for the baby, but I was thinking, remember, in pregnancy, we administer a vaccine to the mothers who are not covered, the tetanus vaccine, because the mother can pass on tetanus to her baby. So
Wow.
we normally give them the diphtheria tetanus vaccine in pregnancy. So we're starting from even intranatal.
Okay.
Okay?
Okay.
And I want to just make a point there as well. It doesn't really happen so much nowadays, but really the child, the baby can get what we call neonatal tetanus. And that happens when dirty or contaminated instruments like scissors and so on is used during the delivery process, especially to sever the umbilical cord. You know, you have to separate the placenta
Mm-hmm.
from the mommy. And
Mm-hmm.
so if your instruments are unsterile, then and it has tetanus on it because the bacteria that causes tetanus lives in the soil. And so it can contaminate our instruments and so on. And so a baby can develop neonatal tetanus as a result of using uncontaminated instruments. Go ahead, Miss Anne.
That's why y'all make sure your instruments are sterilized.
Oh, of course. Yes,
Sterilize every
definitely.
time, all the
Because you
time.
say that, and I'm like, oh my God, should I be worried?
You
Okay.
should be worried. When, for example, I remember during the course of all of my 39 years, there I remember particularly in one of our districts, a father was taking his girlfriend to the riverside to deliver the baby and using a stone to sever the umbilical cord. I remember that clearly. So
Was that a ritual, or was it a
I guess he just don't want
home
any
birth? A home
intervention.
birth? Home birth?
A
Home birth,
riverside
yes,
birth, a
riverside
Riverside
birth,
riverside
birth.
one.
yes.
So
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 those things.
I'm glad you brought that up though. Before we continue on the different vaccines, because we're gonna go back to that. Um,
Mm-hmm.
but in terms of even the practicality of, like, why would you? My question is, considering our environment in Dominica, right? I know we have midwives, I know, but we don't have like doulas and all of these things, right? Where people can go have a home birth and whatever. What is the strongest recommendation in terms of when a mom is giving birth in Dominica? Is it to can a mom consider a home birth, or is it better to be at your go to your district nurse slash your hospital?
But what is most important for us is that the midwife or the person conducting the delivery must be trained.
Trained.
You must be trained to conduct a delivery because so many things can happen during the birthing process that if you are not trained, then the mother's life and the baby's life can be at risk. So that would be the number one thing, that you have a trained attendant. So according to our standards, we really don't encourage home births. We
Mhm.
do have what we call BBAs, meaning they were born before arrival of a trained medical person.
Oh,
Okay, so
I've witnessed a lot of BBAs in my little lifetime, because my mom was a midwife and a district nurse, and many a times I've witnessed people having given birth in transit, whether it was in transit up our stairs or in transit into the ambulance. I've actually witnessed that, so I'm glad you guys mentioned that as well.
yeah,
So.
so really we do not really encourage the home births because anything can happen at home. And
Mhm.
then what services do you have available right away to attend to the baby? You can be born with a flat baby, a baby who's not breathing. Are you able to resuscitate the baby at home? That kind of thing. If the mother is bleeding, constantly, and she has what we call postpartum hemorrhage, are you able to manage that at home? So before considering a birth at home, you would have to consider all of those factors and make sure that you have a trained attendant with you.
Yeah, we have to continue that conversation another day, because I'm loving it. Anything to do with like mommy and birthing and those kinds of things. I love the conversation. So, but we want to get back to the vaccination, because that's what we were talking about. So the last last point where we spoke, Doctor
And
Nurse.
and
I want to call you doctor. I don't know what is it, but I want to call you doctor. Um, you were talking to us about, the different types of. Well, you're continuing where Nurse Louis left off in terms of the different vaccines that one should be getting, or one should have administered to their baby. So you mentioned, of course, the fact that you can give a vaccine to you normally sometimes give a vaccine to a pregnant mom, because they can pass on tetanus to the unborn baby. And I didn't know that. I've had two children. So I'm glad that you brought that up. So continue where we left off in terms of the different stages, or the different types of vaccines that should be considered or administered to the baby, once they're born.
Okay, so nursery stopped off at 6 months.
Yes.
So the next time that we administer vaccine to that baby again is at 1 year old. When that child is 1 year old, we administer what is called the MMR, which is to protect them against mumps, measles, and rubella. I do not know if you are old enough, Jael, to know what mumps was, but we call it lagum.
Lagum.
Right.
That is when you're
Right. And our grandparents used to take a white cloth. I do not know why a white cloth, but they would take a white cloth and they would tie it under your chin and go up on your head. I do not know the rationale behind that. Okay. And interestingly for us, for our boys, this is of particular concern
really.
because if a boy gets mumps, especially during his teenage years, it can lead to sterility.
Oh, wow. Wow.
Mm-hmm.
So it is very important that they get that vaccine to from like early o'clock to prevent. Does it prevent them from getting mumps, or is it in the event that they get mumps that they does it absolutely, like, so if you take an MMR vaccine, because that is
You
the one
should
I really
not
know, you
get
should not.
mumps. If you are immunized with MMR, you should
Okay,
not
not
get mumps.
okay.
You should
Okay,
not
because
get
because
measles.
COVID people got COVID with COVID vaccine. So I want to be sure, I want to, and I like the fact that you said that. And I mean, I knew that that is a fact, for a fact that you should not get it. And I'm glad that you guys are reiterating the importance of getting the MMR vaccine at age 1, especially
1 year.
particularly for the boys who can become, sterile. In
Sterile.
other words, they will not be able to have babies when they get older. So moms, young moms, I saw someone just said on the live, I hope the young mothers are listening. And I want to encourage folks who are on to tag the young moms who are on. Some of them like to do what they want, do their own thing, and they don't really like to get the information as they should. And I'm not saying that to throw shade for anyone, but that is the reality of things. Sometimes we look through the internet a lot and not realizing that, hey, the information is right there with our nurses, with the people that we can see on a daily basis who can provide us with that information. So it's very important that if you have a young mom in your life, you know a young mom, you tag them, because it's very important what we're discussing right now. So the MMR is at, so measles, mumps, rubella. We spoke on mumps, rubella, and measles.
Okay, so I want to interject a little bit about the rubella, because although rubella, for the person who gets that disease, is very mild. If the woman is pregnant and she gets rubella, she will transmit rubella to her unborn child through the
Mm-hmm.
placenta. And the baby will be born with something we call congenital rubella syndrome. And that syndrome has quite a number of symptoms. So, for example, the baby might be born blind, not being able to see, with cataracts. The baby might be born being mentally retarded. The baby might be born with heart defects. The baby will be born with not being able to hear properly, and a number of other conditions. So a baby with congenital rubella is a sick baby. And
So
so we would
so are you
mm,
saying that um a mom should also make sure that she's vaccinated,
immunize.
she has
That's
the
correct.
immunization, because if you're saying that if I take MMR I will not get either of the three, then you should ensure that you are vaccinated even before you consider getting pregnant.
That's
Amen.
correct. That's
Okay.
correct.
All right. So thanks
Go ahead,
for
Miss Anatole.
that clarity.
Right. So, hence the importance of parents now ensuring that their children are immunized so that when they get to their reproductive years, we will not see these kinds of things coming back to us in society. Okay?
Mhm.
And Jael, I'm sorry, but I just have to give that scenario. So I don't know if you're old enough to remember. We used to have the school for the hearing impaired. Remember that?
Yes. Yes. I'm old,
Right.
I'm 40, I'm 40 years young. I'm 40 years
Okay.
young. So I know a little something.
All right. So I remember having to do a research because we had to verify that Dominica had successfully eliminated measles and rubella. And one of the things, when you do research, you have to do a lot of literature review and you have to look at your data that you have. And so we went through all the case notes of the persons who were at that school and the persons born with hearing difficulties. And the majority had their mothers being afflicted with rubella during pregnancy. And so we saw since the introduction of the MMR vaccine that we have are not seeing children being born deaf anymore. And so the school eventually shut down because the children were not coming in again having difficulties hearing. We are now having hearing loss, but it is secondary to all the loud music and the earphones we put in our ears, that kind of
Mhm.
thing.
Mhm.
But to have our children being born deaf as a consequence of rubella, that is no longer seen. I just wanted to say that.
Thank
Yes.
you
So,
for sharing
thanks
that.
for sharing that, Nursery. So, Jael, you can already see the benefits of having children being vaccinated.
Yes, because if you follow the protocol that is established in terms of following the what your nurse or your district nurse or your doctor would advise you on, then your child will have all everything covered. And as a result, when they get older, the boys will not have to worry about mumps and getting sterile, as well as the women will have an issue wondering about whether or not they're going to get rubella to give birth to babies who can potentially be deaf or blind or have other severe symptoms. So thanks for sharing that. Again, continue, Miss Anatole, with the
Okay.
different vaccine.
So then the children coming to us again at a year and 6 months. So when they come at the year and 6 months, we administer another dose of the MMR. So because we give two doses as per our current schedule, and
Mhm.
then they get a first dose of a DPT, diphtheria, pertussis, and tetanus. So this is now considered a first booster because
Okay.
when Nurse Louise spoke earlier on about the pentavalent and she spoke about the vaccines that were within the pentavalent, so we have those vaccines therein in the DPT. So this is given at a year and 6 months.
I always wondered why they were split up in I always wondered I think I've answered the question for myself, but I've always wondered why it was split up. And correct me if I'm wrong, but is it split up because of the amount of the virus in the vaccine, and not giving the full dose, or not introducing the full dose to the body because it can potentially lead to worse side effects? Because I know, like, normally when you have a baby who you've just given a vaccine, you'd see that they probably develop a slight fever. Some might develop a severe fever, and I'm thinking, okay, what if they were given it in the full dose? Is that could probably potentially cause death? Is that the case, or is this another reason why?
Okay, so
Because okay,
go ahead,
Nestle,
Anatole.
okay, so if you give all the vaccines at one time, just
Mhm.
as if you take a lot of medications all at the same time, if there is an adverse reaction, how are you to tell? What is it that the person is reacting from, for one?
True, but
And then,
No,
I'm
I
more
don't. I
concerned.
don't think she's talking about like several vaccines at one time.
Yeah.
What she's asking is that in the dosage of a particular vaccine.
Yes,
So, for
giving
example,
from it
the
over time.
pentavalent.
Mhm.
You give a first dose at 2 months, you repeat a second dose at 4 months, and at 6 months, you give a third dose. The reason is that every time you give an additional dose, you are causing the body to develop a greater response to the vaccine. And so the child's level of immunity is
It's
increased
increased.
at every vaccine. So around 18 months or so, we have to give booster doses of the DPT, for example, because the immunity will begin to wane. So it will become less in the child's body. And so when you give a booster, it's like the body revives again and it
Okay.
recognizes and it creates a greater level of immunity. So
You
that's
see,
why we do booster
I
shot.
don't know everything. But I don't know everything. That's why the nurses are here, guys. That's why the nurses are here, and I so appreciate that you guys coming on and you really giving the information, because I do have a large female population who that follows my shows, and I know they will love the information because they can go back and they can listen to it, and take notes, of what is they're expected to do in the event they were to get pregnant, or if even when they have a baby, and in case they've probably missed shots, because that can happen as well. So continue. So we talk about the DPT vaccine that is at 18 months, you
18
mentioned.
months, yeah.
18 months.
Say we last.
And then again, at 3 years, we give them another booster shot of the DPT vaccine. And
Okay.
again, Nurse Liz was just explaining why we offer booster doses.
Okay. Now, if a child misses that 3-year mark for whatever reason, so for example, and I'm going to play devil's advocate. COVID-19 happened, lockdown. You had a child, and the child got all of their vaccines, but when came to that 3-year mark, they didn't receive the vaccine because it was the height of COVID-19. Everybody was inside. Vaccines were not really being administered in that form. What happens to that child today in 2024 if they've never gotten a booster shot? I'm telling you, there are a lot of people who are in this boat, and we want to give them some clarity as to what can they do, how can they go about it, or what happens to that child, or what could potentially happen to that child.
So we encourage the mothers, Jael, to bring the babies, bring the children to us, and we will still vaccinate them.
Okay.
And
Okay.
So
that is one of the reasons why during this particular time, that is what we are trying to catch up on the gains. We're trying to gain up now on the losses that we made during COVID vaccine. So
Mhm.
we throughout this week, nurses are out in the highways, in the byways. So you will see some of us coming to your homes and we will knock your doors and tell you, I did not see baby Tom for the past 2 months or the last year. What is going on? Is baby Tom still around? So we have campaigns going around within various communities within Dominica now. So parents have that opportunity to catch up. And we also encourage the clients to be friends with your nurse. The nurse should be your friend, so you can contact the nurse. Nurse, my child missed these vaccines because for whatever reason, we are human beings, and you can be given an appointment and something comes up and you cannot keep that appointment, unfortunately. We encourage you to quickly call your nurse and reschedule that appointment so that the child can be vaccinated as soon as possible.
Someone is on the live and is saying that they some of the vaccines, they're uncomfortable with it. I hate this vaccine. My babies are uncomfortable with it. I'm not sure. Please clarify before, so I can ask the question properly, to the nurses, so they can answer. What exactly don't you hate? Is it something that it does? Is it a side effect that your baby has or your babies have had that you were worried about? So share with us so we can ask. If you're uncomfortable sharing on the live, you can send me a direct message. So my WhatsApp is on there. You can send me a message directly to my WhatsApp, and I can answer. I can ask the nurses the question. So we're at 18 months and three
three
years.
years.
If you missed, well, the booster, we spoke about the booster at 3 years in terms of the DPT.
Before she continues, I would like to say that everything that we take into our bodies, especially drugs, they have side effects. Even
Mhm.
the paracetamol that we take, we have side effects, and we have to be concerned about maybe too much for our liver, because our liver might not be able to manage the drug that we are taking. So I'm saying all of this to say that the vaccines themselves have side effects. Okay, so I am not saying they don't have side effects, but
Okay.
we are saying, and the data is saying that the side effects are mild and
Mm-hmm.
they are self-limiting, meaning they do not last for a long time. So, for example, the child who gets the pentavalent vaccine, we expect the child to get a fever. And the reason for the fever is because the child is developing his or her own immune
Immunity.
response. So that
Mm-hmm.
peradventure, the child gets in contact with the bacteria that causes the particular infection. The child's body recognizes it and will realize that, oh, I have had experience with that bacteria before. Let me fight against it. And so the child does not come down with the disease. We also have to bear in mind that we are living in a global community and that there is very little difficulty in getting from one area to the other. We have those diseases still in some of our country, even in our region. Brazil has measles.
Measles.
Okay, even the US has pertussis. They also have cases of measles. And what they are seeing is that post COVID, there are increases in those diseases because of vaccine hesitancy. People complain they don't want to take the vaccine. And so we are seeing a resurgence of those diseases that we once thought we had under control. And so for us in Dominica, we don't want to see any of those diseases again. So we want to make sure our children are vaccinated.
What sort of strategies though have you guys put in place or even considered? Because obviously, as you would expect, a lot of people who went through COVID-19, they may have, because nowadays, I'm gonna be straight with you guys. Nowadays, anybody you hear who fall on and die, they're like, oh gosh, COVID
It's
vaccine.
COVID.
It's COVID vaccine that killed them, right? We're hearing a lot of that. A lot of young people dying, a lot of young people dying from heart attacks, a lot of, and some people are saying that it's the vaccine that's causing it. And as a result, because it has been the most talked about vaccine, the word vaccine has become like,
Taboo.
oh, taboo,
Tabooed.
very taboo. Nobody wants to go. So, what sort of strategies have you guys been implementing in terms of getting people back on the bandwagon? In terms of, because my understanding of these vaccines that you've spoken of is that they have been tested and tried for years, not 18 months, not 9 months. Like the COVID-19 vaccine, but years. Multiple people have they've tested it on animals, they've tested it on people, and through time, why you can stand up today and say you will not get this, if it's because it's been proven and it's been tested, that you can say you will not get measles, you will not, because in our minds, and I'll tell you, when COVID-19 happened, in my mind, when I would receive a vaccine, I would not
Okay.
get get X, or I would not. But that, it was not what happened with COVID or COVID-19 vaccine. And as a result, it kind of created a fear in the minds of people that vaccines were no longer
Safe.
safe, or we were now resistant to these different vaccines. So if you can share with us some strategies that you guys have taken or are taking, and what are some of the things that we can do to set our minds at ease, and to go back to the
The
regular
pre-COVID, the pre-COVID
COVID.
era,
Yeah.
when we had when we had vaccine acceptance was much better than it is now.
Mhm,
Unfortunately, for real, the COVID did a number on our vaccines. Okay, and
mhm.
honestly, the people had their legitimate concerns. Even I mean, as a healthcare provider, I also had my own concerns. Oops, I'm so sorry.
Okay, it's okay.
I also had my own concerns about COVID 19, and the fact that it was prepared so quickly was one of our concerns. But remember, they would have had the ability to prepare vaccines because they would have had the blueprint for a long time.
Mhm.
Okay, so and remember, technology now is much better than it was before. So whereas it really did take a short time, they had the technology already there to develop the COVID-19 vaccine. One
And,
of
and,
the issues that people have,
and I believe you on that, but people who
right?
not getting vaccinated still got COVID. So
Yeah, so that is
that,
what I was going to say.
right.
One of the problems people had And I also had that problem because, so that's why some people didn't think it was a vaccine.
Mm-hmm.
Because for the other conventional vaccines like the MMRs and the Penta, we've had a long history of having protection. And if we get any of those bacteria or viruses, we would be protected. But unlike the COVID-19, because it was a new technology, they said that we could still get COVID, but what it was doing was reducing the severity of
The
COVID and
symptoms.
decreasing the mortality or the death rate from COVID. So it was making the symptoms better. And so people were able to cope with it, especially those with high risk conditions like the hypertensive, the diabetics, and stuff like that. When they got COVID, if they were immunized, they fared better than those who were not immunized. So that
All
is
right.
what I can say. So that because of the COVID fear, people think now all vaccines are the same. But I really want them to forget for now COVID-19 and refocus on our conventional vaccines and bring the children back. I wish I had an opportunity to show you some pictures of some of the complications that may arise from some of those diseases. So, for example, measles can even cause blindness. Can you imagine your baby all of a sudden is not able to see because they get measles?
And there
And
was an
some,
outbreak of measles in France. Somebody just pointed that
yes,
out last summer, and we're coming
yes,
up to another summer, so you never know what can happen. Now with the Sahara, does you pass a psych, I mean,
exactly, exactly. So
right?
we have to ensure that we bring the children who have defaulted. And if you have questions and concerns, rather than just stay home and say, oh, me, I'm not in that, I'm not bringing my child for vaccine, come and sit and talk with your nurse. Your nurse will be able to allay your fears and your anxieties. If she has an issue that she cannot deal with, there is somebody higher than her. There is the doctor that we can refer to so that we can help you to become comfortable again. And we don't just give you a vaccine and we leave you. No, we have to leave the child in the facility for about half an hour to an hour once you have the time, just to observe the baby and to make sure that the baby is well. We give you the education that you need so that the baby, you know what to do if your baby has a side effect. But some of those things that happens, they are normal reaction. So it is expected that the baby will get a fever. It is expected that the baby will have pain at the injection site and swelling and redness at the injection site. But if any other thing happens, we call it an adverse event, and we are right there and we are doing investigations to find out why did that happen.
Okay.
Okay, so we don't just give you a vaccine and forget about you because your baby is our baby. And we are concerned about the welfare of our children. And so we want to ensure that the children are covered, they're protected, they can grow up to live productive, healthy lives.
Fantastic. So if there's anyone who missed the vaccination period, especially during COVID, when people were indoors and not doing, and you probably just say no, oh, you're pas vaccinated, you're pas tape wim, you're fine, they're okay. That is a complete miscommunication that you've given to yourself, because your child is also, especially if they go to school, they can be exposed to so many different bacteria and can eventually become sick. I want to play devil's advocate because I know some people choose not to vaccinate their children due to religious beliefs, especially like you have to think of communities like the Rastafarians. They may say, we choose. What are some of the strategies that you guys implement in terms of that consideration, that for particular beliefs that they may choose not to introduce anything into their children?
Okay, so Jael, we have an immunization, not an immunization law per se, but the Public Health Act that is part of the Education Act has a clause in there that says that the child must be vaccinated prior to school entrance, so that all of the children who come into the school should be vaccinated. So if a parent decides it's their human right, we don't have a vaccine law in Dominica that says everybody must be vaccinated. Okay? However, before school entry, the child has to be vaccinated. So you choose. And what we have seen is that The parent might refuse vaccines when the child is a baby, but when the child has to go to school, or especially those days they have to go to university, guess who comes to the health center? Nurse. And sometimes they want you to manufacture vaccine records for them that's not there because your child was never vaccinated. And what
Because
about
it is required. It is required for entrance into
exactly?
university. And somebody mentioned that on the line. Madeline, thank you very much for your contribution on the live. I mentioned that that even to attend universities, they tell you MMR you must have it, and if you don't have it, go get it before you come in.
Yes.
They want those records. That is very important. So thank you for sharing that.
And
And
even for the
also
for the
for the
green card, when they have to go
right.
and get the green card, these same people they come. So while we respect people's beliefs and we know that people have their rights, what we do, we give you information in order that you can make an informed
Informed
decision.
decision.
Because a lot of times people say, oh, but I didn't know, nobody told me. So yes, you do not want the vaccine. However, we will still let you know of all the benefits that your child can have, and we will let you know of the risks and the harms that you are exposing your children to. And we all know that we love our children, or we expect that people should love their children. And if you love your child and children, you will do what is in their best interest to protect them, which vaccination is one of those things.
So run for me again. I want you to, because we getting close to the end of the show.
And
We'll
you're
probably
already imagine that.
we'll probably take. I wait. I tell you, I told you we're going to have fun. I told you we're going to have fun. So think about a 5-year-old getting ready to get into school. What are some of the vaccines that that child must have or should have in order to enter elementary school? So if you can just give us a so if somebody's on the live right now, they want to take notes because somebody's asking, what should they get at 5 years and what should they get at this age? So if you could give us a run from 5 years back, I know you mentioned some, but in between we had conversations and some people might have lost track of which one they get in when. So just give us a run through us from 5 years back or from birth to 5 years. What are the vaccines that children need to have before they start school?
Okay, so Jael, even before they start school, they start kindergarten, they go to preschool. And before entry to preschool, I'm sure every mother on the live will note that the preschool teacher gives you a form that the nurse has to fill in for you. The form will indicate which vaccine that the child has taken, including BCG, 3 doses of pentavalent polio vaccines, first and second MMR, and there are 2 doses of the booster DPT vaccines and polio. So once they have that, they're good to go for school.
They're good to go.
Yes,
Somebody's
and we
asking
don't give a
at
vaccine
5.
at 5. No,
No
we
vaccines
don't
at
give at 5. The next vaccine is given at in grade 6
Grade
when the child is
6.
between 10 to 12 years old in
and
grade
what
6.
vaccine is that?
And that is a booster dose again of the DT. Okay, diphtheria and tetanus, again, because the level of immunity wanes over the period of time. So the child has to get a booster dose. And then we also give the HPV vaccine, which is a vaccine against human papilloma virus that causes cancer of the cervix. And can also cause cancer of the penis in men. And we have seen cancer of the throat from having oral sex. We see cancer of the anus because
Wait,
of the
wait, wait, wait,
HPV.
wait. So the HPV is one. I know. I remember like being told about it on numerous times that my doctor in Canada make sure that I get it, and I chose not to get it because I was just like, oh, I don't want another vaccine. But that's very important that you brought this up because there are extreme cases where there are cases where you can develop. You mentioned cancer of the cervix, in men, cancer of the penis, and also cancer of the throat,
And anal cancer.
and that is from oral sex.
Correct. That's correct. Okay,
Y'all
so
hear?
the
And those are
HPV
cancer of
vaccine.
the anus as well.
And,
Okay, and those days,
now with our laws, you
Okay.
gotta. Okay, our laws have been
All
amended.
right.
So pay attention to that. Now, with
Yes.
that HPV vaccine, is there an age range, or at any age you can walk into your health clinic and say, I need to get the HPV vaccine? How does it work?
No, so according
So,
to our schedule for now, we give HPV to our children in
school.
grade 6,
Mm-hmm.
11, and 12 years old. However, we can go up to 14 years old with our children, and they can get though we have changed our schedule, so that is important to note. We used to give 2 doses, but research has proven that the 1 dose is as effective as 2 doses. So we are no longer giving 2 doses of HPV, we are giving 1 dose. All right.
Mm.
And then we can give HPV up to age 35 as well. But in a case like that, the person will have to get 3 doses.
So,
The older they are.
moun kon mwen kon sa.
Who told
Expire.
you? Who told you? Yeah.
Expire.
I expire. So bad point mwen.
Bal point.
Okay, so next carbon, so essentially, it's you guys are going to be on the road over the next couple of days, and parents, so I'm asking for myself, parents who probably have missed vaccination schedules, who are not able to probably get to, and people like me who straddle between Canada and Dominica. Things happen where you don't exactly have all of the information. You have some from one country, you don't have some from the other, and these kinds of things. People should be reviewing their records right now. So you're
Yes.
urging parents, all parents, especially if you have children in school, to look through your records to see what your children have received and what they need to get. So essentially, if it's the formative vaccines, the ones that they get up to the time that they get into school, or the one that the booster that they will get at age 6, or even the HPV that they will get between 6 and 14 based on the schedule. These are things that we should be reviewing as parents to make sure, and like you say, make this our best friend, so that we are able to keep our children up to date on their vaccines, and completely covered, so that they don't get those viruses, or those bacteria, I should say, and end up sick, right?
Yes. And we are also, importantly, we are also offering vaccines to our adult population. So, for example, we offer in the hepatitis B vaccines because we have persons who work in high risk professions. So, people like the sanitary engineers, the people who doing the cleaning, the beautification of the roadside, our police officers, our fire officers, we encourage persons to get the hepatitis B vaccines, the DT vaccines, especially the tetanus one, Jael, because sometimes we in farming communities, we do construction and people get injured and they run to you for they want a tetanus injection now for now because they figure out that it is an emergency they have, but it is not an emergency. So we encourage persons to get the injection prior to being injured because you provides you with the protection for when that injury occurs. But when you already have that injury and you come for the tetanus, yes, we'll give it to you, but guess what? It does nothing for you for that present injury that you have.
Whoa.
Right. So that is why we encourage people, you have your little vaccine cards, review them as well, adults, and then make contact with your nurses in your nearest health facilities and get vaxxed.
Nurse Louis, I coming to you ASAP, because I'm going to go for my child on to see what is necessary. If there's anything missing, I feel like something missing. Like from the time you all start talking, I get nervous.
Right.
Right?
Unpredictability.
I might be, because COVID happened. You had little ones, and things could have just gotten
Yes.
missed. And oftentimes, we see, because my kids are as fit as fiddles. They very rarely do they get sick. So you say, oh, the child doesn't get sick, and you just figure that that's the end, and that is how our society tends to operate too. They tend to say, oh, they doesn't get sick, my child. Zama mga tabi malad, mazama mga ni him. Or a little cough the child does get every now and again, my child doesn't get. But we take all sickness and we lump it in one as a cough. and all sickness is not a cough. So there are mumps, there's measles, there's rubella, what about the chicken pox? The chicken pox, there's all different kinds of things that
Mm-hmm.
can contract and come home with, and then infect your entire home if you yourself are not vaccinated, and potentially become sick and probably even die, or
Mhm.
lose their hearing or their sight, or
Mhm.
certain things. So we have to be very aware of this, and also the notion, or the fear that people have developed as a result of COVID vaccine, and they've kind of built a resistance to not wanting to return to get vaccination. We can put COVID as a myth for now and go back to the old days, right?
Right, right, right.
Yeah,
Did the
because
person ask?
sadly, in our other Caribbean countries, we are seeing people coming down with measles and all of that now. And it's because of COVID, people decided they're not getting vaccinated. And now the world is a global village. In less than no time, in 3 hours now, you're on a plane and you're from one state to another. You're from place to place. And while you may want to visit a country jail and they'll tell you need a visa and you need this, the disease don't need any visa. And it is not stamped on anybody's faces, so you can see it. So that is why the onus is on us as parents to ensure that we protect our children,
Mm,
because one vaccine preventable disease for us in Dominica is one too many. And our grandparents used to tell us that precaution is better than cure.
thank you.
So do not wait until it hits home and then you hold in your hand and you're running. Nurse, look this, look that, and then for you to start playing blame games. As you rightly said, COVID happened and we all knew that. And that is why now we are going through the lengths and breadth of Dominica to ensure that we catch up. So I am happy that we are having this session now, and we are encouraging parents, as you rightly said, check your child's book. If you do not have time, we will be going to the daycares, we'll be going to the preschools. Send your child's book. So the nurses will be sending out notifications to the daycares and the preschool. So it is a good opportunity to have your child vaccinated, because while we are there to help and to support, the ultimate responsibility of your health and that of your child belongs to you. And the good part about it is that the vaccines cost so much money, but guess what? It comes free to the public.
Mhm.
So nobody have an excuse to say, well, I do not have the money to pay and I do not have that. So we are urging you to please get your children vaccinated.
Before Ms. Lewis gives her final words, and thank you very much for that, Ms. Anatole, Ms. Carbon, for sharing that with us, and for for reiterating the importance of getting vaccinated. I want to just take some comments, just so you guys can get a sense of what was being said while you guys were talking, and then I'll hand it over to Ms. Lewis so she can do the final wrap up. So folks were saying, it's best that parents allow their children time, have the HPV before age 15, or first sexual contact. That is Regina that was chiming
Very
in.
good.
I'm
Mm-hmm.
letting folks know. Avril saying this is so informative, and she's one that said, she was worried because it was very painful for her children, and now she's singing. This is very informative, especially the education on HPV vaccine, and I'm guessing that she didn't know about it, so it's great information for her as well. She also asked a question about why don't we get children vaccinated, or do we get children vaccinated against meningitis? And I want
The Hib vaccine protects against meningitis.
okay, so the
Yes.
which is what time
The
they get
one in
that?
the pentavalent, first at 2 months, 2, 4, and 6 months.
Okay. All right. So we do in fact, Avril, I hope that answers your question. Cynthia is saying very informative program. She's also saying Nurse, oh my god, her message keeps going. Nurse Luis and Nurse Carbon, thank you very much for information. Great interaction. Folks are saying thank you very much. Folks are saying they're waiting. Very informative program. Someone is saying great job to the nurses. That is Markima Seraphin is saying great job to the nurses. A different Avril is saying excellent program. Enjoying the program, and Laura is saying thank you very much. She is waiting. I don't know what you waiting for, Laura. I'm not sure what you're waiting for. I guess probably notification at at her daycare, because Laura does have a daycare. So she's probably waiting to see when she gets the notification that you guys will be stopping off out of her daycare. Your daycare is in Stockfarm, right? I believe her daycare is in Stockfarm. I swear I know everybody business on this. You see, I know my followers. So a lot of positive feedback is coming from the folks who are on the live. Deanne Charles, who is on YouTube, is saying you are all doing a very wonderful job and commending you guys. So she's locked in on YouTube, and she's also saying that. So nurseries, I want to leave it to you now to wrap up, to have the final say in terms of what the general public should know. What if we missed anything? I doubt we left any stone unturned. But if we, it would be nice to have you guys come back again to talk about a different. Doesn't have to be vaccination. It could be come and talk about prenatal care. Come and talk about anything y'all want to talk about. It was very nice having you guys. So I want to give you the final floor.
Once we can get sponsorship, Jael, we can come again and talk on a topic that will be of interest to your mothers. So I really am truly, truly elated to have been on this program with you. I really trust that the information that we shared with the listeners, they will put it into practice. They will tag another person and give them the information. And what we want to see is that parents, especially who have had children that have missed their vaccinations, to return, to bring them to the health center, or give us access to those children at the school, at the daycare, so we can vaccinate the children for you. So when you get a notification, send the health card so the nurse can look at it, and we can, once you send it, we know that you have agreed to have your child vaccinated. So support us to protect your children. And I know some parents say, oh, I prefer my child get the disease. Really? If the child gets the disease, then the complications of the disease will be more severe than if the child gets the vaccine and is protected. Okay, so I want to really thank you for having us and encourage our population out there to come in, especially this week, and have their children vaccinated.
I absolutely loved having you guys on. I learned a lot. It's always a learning experience for me, whenever I have any guests on. And one of the things that I must say that I learned is that, all of these vaccines that you were referring to prevent people from getting the various diseases. So it's not oh, you might get it, or you might see no mites, right? These are the vaccines that we were speaking about here today. These will help protect your little ones, your children. There's no need for your child to get sick, and if you say you prefer your child get sick, that is pure ignorance. That's a pali sort, right? So we want to I want to say thank you very much to the Ministry of Health, Wellness and Social Services for connecting with me and wanting to bring you guys on air. And thanks again to Paho, who sponsored this program. And special thanks to both of you nurses who took time out of your schedule, because nursing, boy, nursing is all your nurses all around the clock.
Yes,
So your day has ended. The information that you've provided is so valuable for us women, for us mothers, for us people who care for their homes, people who have families. And the information that you've provided is so very important. And I know a lot of us, I say us, me included, will put the information in our pipe and we'll smoke it. So thank you very much to you, Nurse Yvonette, Anatole Carbon, for coming. You say I finally called you nurse. Thank you very much.
Finally.
for coming on and speaking with us. And thank you very much to you, Miss Nurse Florentine Lewis, for coming. I know Nurse Lewis forever, since the days of my mom and stuff.
Your mother, yes.
I've known Nurse Lewis forever. So thank you very much for taking the time out of your schedule and coming on and sharing with us, sharing with the audience. And I do hope you guys have a really engaging week, and a lot of folks flood into the health centers and come and make sure that they are up to date on all of their vaccines, right? Thanks again, guys.
Thanks
you. For
Thank
having
you.
us.
Thanks for having us.
Bye-bye.
Bye.
Okay, cool.
So, guys, that's it. Ooh, what's going on here? Let's That's it. That's it. Sorry, guys. That's it for tonight. Thank you very much to all those of you who joined in. Thanks again to the Ministry of Health, Wellness, and Social Services. And I think this was a very informative show. I hope you guys learned a lot. You can always go back and listen to this. It's available on YouTube if you want to share with a friend. You probably might come on Facebook and you might say, Bonze, where is the show Jael was talking about? I can't find it. It's also available on YouTube. It's very easy to find all of the shows on YouTube. So you just go on my YouTube page, you subscribe obviously, and you just search the name. You could use the keyword. You could use keywords like vaccination week, and you'll be able to see repeats of the show, and you could even share it with your friends, your family, your loved ones, especially if you know that they may need to know that information because it could potentially save a life. Thanks again to everyone who tuned in and contributed. Those of you who are on the live, thanks to you, Avril, Laura, Mavlin, and the rest of the gang, every single person who's been on the live. Thank you very much for taking the time out and coming here and sharing with us and speaking with us. Have a great evening. I'll be back tomorrow evening. I will have the folks from PEG. That is, we'll be talking about autism because the month of April was Autism Awareness Month, and yes, we do have people who have children who are autistic, and we're going to be talking with them, and they're going to be sharing right here on the program. And I want to encourage you all to show up tomorrow, same time, same place, 7 p.m. So I'll see you guys tomorrow on Wednesday. We'll have we have an artist coming in. God, I just drew a blank. So tune in to the shows. We're going to be continuing to share information for you. Make sure you follow, like, subscribe if you haven't. And I'll see you guys tomorrow, same time, same place, right here on Jael Joseph Live. Thanks again, guys, for tuning in. Bonsoir. Bonsoir tout le monde. Bye-bye.